Hello everyone, Dr. Suresh here, and here again I come up with one more case based question related to glycogen storage disorders, and this case based question will be repeatedly tested in NEETPG and in FMGE. So let's have a look of this case based scenario. So here a 1-year-old boy brought to the emergency by his parents because of severe hypotonia. Okay, that is one clinical feature. And the patient mother states that he had difficulty feeding. Second, this one, because of progressive dyspnea and fatigue. Physical examination shows a liver edge about 5 centimeters below the right costal margin, and rails are heard on oscillation of both lower lung fields. A chest X-ray shows cardiomegaly. So here the key words, what are they? One is hypotonia is one. Next is dyspnea, difficulty in feeding. Okay, and the next keyword, that is cardiomegaly. Cardiomegaly. So after seeing this, what you can make out? Considering the signs and symptoms, okay, what they have asked, deficiency of which of the following enzyme is most likely responsible this patient. So we have already said that it is a glycogen storage disorder. There are several types of glycogen storage disorder there. If you want to get to know much about glycogen storage disorders, I have provided the game app link in the description. You can go and subscribe and access the content. So here the options has been given: glucose 6-phosphatase, glycogen branching enzyme, lysosomal alpha-1,4 glucosidase and myophosphorylase. Which one is the correct one? So based on the symptoms, we made 3 key terms. One is hypotonia, dyspnea and cardiomegaly, right? And my answer will be lysosomal 1,4 glucosidase. Why option C is correct? Why lysosomal alpha-1,4 glucosidase? I will tell you, I will explain. First let me evaluate other answers and discard them. First is glucose 6-phosphatase. What is glucose 6-phosphatase? Glucose 6-phosphatase is the enzyme involved, okay, and its deficiency causes von Wieck's disease. Remember, the deficiency of glucose 6-phosphatase causes type 1 glycogen storage disorder, von Wieck's disease. Whereas glycogen branching enzyme, what it will do? Glycogen branching enzyme, this involves what? Because of this deficiency, Anderson's disease. Anderson's disease. And fourth option, myophosphorylase is the muscle glycogen phosphorylase enzyme deficiency. It gives you McArdle disease. Fifth one, right? So glucose 6-phosphatase, Van Wieck's disease because of the enzyme deficiency, glucose 6-phosphatase, and glycogen branching enzyme deficiency causes Anderson disease, and myophosphorylase is McArdle disease, muscle glycogen phosphorylase deficiency, right? So the correct answer will be lysosomal 1,4 glycosidic glucosidase enzyme. Here this lysosomal alpha-1,4 glucosidase enzyme, otherwise known as acid maltase. It is a lysosomal enzyme. Remember, lysosomal enzyme this is a lysosomal enzyme, okay, lysosomal enzyme. The defect organelle will be lysosomes, the accumulation of glycogen in the lysosomes. And to talk in detail, so what happened now, we have said that what might be the condition, it is type 2 glycogen storage disorder, that is Pompes disease. Based on the symptoms, clinical features has been given in the stem of the case, it is Pompes disease. And what are the characteristic features of Pompes disease? We will explain. There are two types of Pompes disease. One is infantile Pompes disease and other one is late onset Pompes disease. I mean, after the infantile stage, adult stage you will get Pompes disease, late onset Pompes disease, infantile Pompes disease, late onset Pompes disease, two are there. So, in case of infantile Pompes disease, it is more common and lethal. Okay, infantile Pompes disease is common in infants and lethal. Okay, and the main characteristic feature of infantile Pompes disease is cardiomyopathy. Cardiomyopathy, that means enlargement of heart. So, here we have one this one symptom, clinical feature, cardiomegaly is there, right, cardiomegaly, and leads to cardiac failure and death, But whereas late onset, you can see it is more of like, here infantile Pompes disease more of cardiac manifestations, remember cardiac manifestations, and late onset is more of like, what to say, it is more of like skeletal manifestations. And it is not that lethal, okay, and these are like there will be not much cardiac manifestations, only skeletal manifestations are prominent in late onset. And if you go in detail about the characteristics of infantile Pompes disease, the characteristic features like, what to say, in infantile Pompes disease, muscle weakness. One first thing is muscle weakness, that too hypertonia. What is that? Hypertonia. And that is why, because of the hypertoning of muscle, there is a floppy baby posture, you can say. What is that posture? You can call floppy baby appearance, frog like structure. Because muscles are in hypotonic condition, baby cannot move, okay, it will be like floppy baby posture. And these things again leads to cardiomegaly and death, okay. And other characteristic features, if you see, feeding difficulties. Here mother also complained the same thing. What she has complained? She has complained that baby is facing difficulties during feeding. So, in infantile Pompes disease, difficulty in feeding and leads to what to say, failure to thrive. The main another characteristic feature, failure to thrive because of difficulty in feeding. And another prominent thing is delay in milestones. Delay in milestones. As respiratory muscles are weak, there is a respiratory failure. So, here also you see dyspnea is there, right? Dyspnea is there. That is the reason, because of weakness of respiratory muscles. So, respiratory failure will be there. And other thing is dysmorphic facial features. Dysmorphic facial features. So with that itself we can clearly make out what are the things. One is hypotonia is there, okay, muscle weakness, that's why fatigue, and floppy baby appearance, okay, and difficulty in feeding, that is also there, and dyspnea is there because of failure of respiratory muscles causing respiratory failure. Cardiomyopathy is also there, cardiac failure. So all these symptoms related and get us to a conclusion that it belongs to, this case is based on the symptoms of Pompes disease, which is a type 2 glycogen storage disorders. So that's all about this case. If still want to know much discussion about Pompes disease and other glycogen storage disorders, do access GAME app. The link has been provided in the description. Thank you.